So welcome everybody. Thank you so much for being here and taking your valuable time to spend an evening and an hour with us. We have the privilege of listening to Dr. Victoria Liotta, who is a doctor of acupuncture and is a New York State licensed massage therapist. Dr. Liotta's goal as a healthcare practitioner is to utilize her knowledge to help those with challenging health conditions, but her philosophy is simple. And I really like this philosophy. It's, quote, take care of yourself now. And I know that seems very simple, but it's not always that easy to do. And wonderful practitioners like Victoria can really help us do that. She considers herself a general practitioner of acupuncture. However, most of her patients present with pain of the body, limbs, or head. In addition, Dr. Liotta frequently helps those with anxiety and depression. Patients respond well to her attentive demeanor, knowledge, and technical expertise in acupuncture. And I could certainly attest to that. Many of my patients also work with Dr. Victoria, and I just hear resoundingly how wonderful she is, how kind and gentle, and how effective she is at the same time, which is just the best combination when you're working with a healer. So I will give it to Victoria. Enjoy the show.
Thank you, Dr. Buongiorno, and thank you everyone for joining us this evening. I'm going to talk about neck pain because neck pain is probably the top, or actually not the top. I'm going to say comes second only to lower back pain for what I treat as an acupuncturist and massage therapist. So I thought it would be a very good idea to do a talk on it, talk about some of the common causes, what we can do to prevent it, how I could help you, maybe do some stretches together, and some other advice and tips. And then if I have time, I'll answer some questions. And if I don't have time, I'll just tell everybody now, you can email me, and I'll have my email at the end of this talk, and I'll be happy to answer your questions through email, okay? So let's just talk about the common causes for neck pain. First off, poor posture. I look at the picture here at this young lady staring into her computer screen, and I just think about everything that we've been doing for the past 6 months with COVID. We've all been on Zoom. We've been working on our computers more. We've been now, kids at school, teachers at school are on their computers. Everything is done on a computer and for many hours. So we're stuck, looking down for the most part. And it really, it's going to affect our posture if it hasn't already. We're already prone to being on computers, for many hours. Anyway, I could have said this a year ago, but especially with COVID and doing things online, it really is affecting our posture, especially the musculature of our neck, okay? Because when you look into a computer, usually
Victoria,
myself, I'm like
interject for a second.
Sure.
I don't see your PowerPoint, so you might want to bring that up on
Oh.
share. Yeah.
It's not on?
I don't believe so.
Okay. All right. Let's see.
Can anyone write in the chat if they see the PowerPoint? I don't believe it's up there. Sorry about that.
I don't even have that. Why don't and I am so sorry, everybody. We were having some technical issues, earlier, and I want to share from the beginning. Is anybody seeing it now? No, probably not.
Yeah, no PowerPoint is visible.
All right.
So, yeah, so just hit the share screen button at the bottom. Do you see that?
I don't even, why don't I see this? Anything now?
Nope.
No. Okay.
Usually a green button at the bottom. It says share screen. And
I know, I usually have it at top. I don't know why. Let me see. No, this is some kind of. All right. Oh, let's see. What's this?
I know we saw it before, so.
Okay. I don't know. You know what? Do you mind if I sign out and go back in? Or is that?
You can do that. I believe because I'm on, it'll stay on, so we'll try that.
Okay, and I apologize to everyone. Let me see what I can do here.
Unless you want to see control back to me. Oh, okay, you popped out. Okay. Here you go. Thank you, everybody, for hanging in there with us. If I had any music, I'd put it up now. Now would be a good time
Yeah,
for
we
a
were
little
talking about
elevator music. Aha.
All right. Am I sharing?
Yes, it's on. You got it.
Okay. All right. Maybe it's a good thing we're not on Facebook Live. Okay. Well, thank you so much for bearing with me. I was just talking about poor posture. If you just joined us, talking about neck pain and some of the common causes now. So yes, for the past 6 months especially, we have been staring into computer screens, and it really is affecting our posture, which when our head is forward, like in this picture, this young lady looking down the computer screen, it does affect and put pressure and contract some of the muscles of our neck, okay? Now, I'm not recommending that you sit upright, you know, in military posture all the time or walk around with that kind of posture, but with posture, you pretty much want to, you know, just have your, shoulders at a even level, you know, your head back a little bit, and just be like relaxed as you go through your day. And if you find yourself, you know, leaning over a desk or a book or a computer, try to just, sit back a little bit and, you know, lift your head and, check on your posture. Another common cause for neck pain is stress. Now, I know when I get stressed, I find that my shoulders are suddenly up to my ears, which causes all constriction in this area of the neck and can cause pain. You're not getting proper blood flow. Even when you're driving in traffic, you might find you're like this suddenly, you know, same kind of thing. So stress can put pressure on the muscles of our neck because, you know, we're just frantic and just everything's constricted when we're stressed. And in Chinese medicine acupuncture, we talk about stagnation. And when there's stress, things get stagnated, they get tight, okay? Things get constricted. And when there's stagnation, there's pain. So we want to take away that pressure, that stagnation, so the energy or the chi, which I'm going to talk about a little bit later, can flow and we can remove that pain. Many of you have heard me talk of trigger points. Trigger points are basically knots. You know, like people come in and they see me and they say, I've got pain here. You know, I've got like a big knot here. You know, what can I do about that? The trigger point can be it's defined. the best definition that I ever read, the most interesting definition I ever read for a trigger point is a hyper irritable spot. And it really is. It's that spot sometimes that you can't reach, or in the back of your neck, or on the shoulder, you know, through the trapezius, which is the muscle that runs here, that is just, you know, you just can't work it out on your own, okay? And there are some remedies that, are good for trigger points. Trauma or an accident can cause neck pain. When people come in with neck pain, one of the first questions I ask is, have you been in a motor vehicle accident, either recently or years ago? And often they say yes, okay? They might have been hit from behind, where their head goes forward and back. That would be like a whiplash. accident. And that can cause, future neck pain. Usually after an accident, you don't feel it right away because your body is, so in shock. But, a couple of days later, you might feel that pain. And it's good to get that type of pain addressed immediately. Also, sports injuries, especially football. Football players are prone to different types of injuries, and neck pain is one of them. Herniated discs or something that are involved with neck pain. A lot of people say, well, what actually is a herniated disc? I've been told I have them, but what is it? And what I want to explain is when you look at the spine, it's basically a bunch of stacked vertebrae. They all stack up and they have throughout the spine from the neck all the way down to the lower back. And there's a space between them where a disc lies, and that's the intervertebral disc. Makes sense. It's the disc between the vertebrae. And that disc has two parts of it. And the best way it was described to me once was, you can think of like a jelly donut, okay? So you have the donut and you have the inside jelly part, and then you have the outer doughy part. So when you look at a disc, the disc has a gel part, which is the nucleus pulposus, and the outer part, which is a ring, is the annulus fibrosus, okay? Getting a little technical here, but basically you have an inner part, which is a jelly type substance, it's a gel. And if you get injured, the disc can become herniated, which means that gel presses through the doughy part or the fibrous part, and it can cause pain especially if it irritates a nerve. And that's why sometimes, you can have tingling in your hand or down your arm, or a numbness in your hand or fingers, and the doctor tells you, well, it's stemming from your neck. Okay, so that's the gel part of the disc pressing through and irritating a nerve, and that can cause pain and discomfort. Arthritis commonly causes neck pain. Arthritis basically is an inflammation of the joint, and the spine is, a joint. It's made up of joints, and that can cause stiffness, poor range of motion, and it in so much disease, autoimmune disease, and it causes swelling. It can cause heat to the area and a lot of discomfort. And that really, we'll talk about diet later on when it comes to inflammation and how we can avoid it and control it. So symptoms, we're all familiar with tight muscles, muscle spasm. I mentioned difficulty moving the head and neck, poor range of motion when there's neck pain. The trigger points, that knot that you may be experiencing, that's just like, oh, that spot right here. And also headaches. A lot of neck pain can also cause headaches. It really is. Things are really all connected, because the muscles that are in the neck or run up through the neck tend to attach to the head, so you can move your head. And they tend to attach especially to the base of the skull. So many times there's a lot of tension in the base of the skull, and it could cause a headache in the back of the head, or even it could pull all the way to the top and into the temples. Those are like real classic tension headaches. And that can be stemming from the neck. Kind of goes hand in hand, the head and the neck, when it comes to, headaches. And numbness and tingling, shooting pain, they could all be, associated with, neck pain, as I mentioned, herniated discs. So what can we do? Well, the first thing I would say is when neck pain is caused from poor posture or, either standing for a long period of time, sitting for a long period of time, whatever it is, take a break from it. from it. You don't have to go and have a coffee break. You don't have to have a lunch or, take a long break, but just, take a break from what you're doing. Like I just did, I just, sat up a little bit. Instead of, you find yourself looking down, just, sit up for a moment, turn your neck a little bit, take just a moment just to break that posture. If you find your shoulders are up, just drop them. Be more conscious of how you're sitting, what you're doing throughout the day. Many of us work out. I think that's great. I've been working out since I was a teenager, but too many of us, we lift weight that's too heavy for our size, okay? So we really need to watch how much weight we lift. If you work out with a trainer that's, great, they could show you how to, the proper amount of weight you should be lifting, especially when it's barbells and dumbbells, and the proper form. Okay, so because a lot of times I worked in the gym for many years, and many people would come in with injuries. They didn't want to stop working out, but they would come in and say, "Oh, my upper back hurts. It's pulling through here and into the neck," and usually it's because they had poor form and most probably lifting heavier weights than they should. Bags also, a lot of women carry a shoulder bag, and the weight from it pulls their neck a certain way, maybe to the opposite way, or they're holding their neck a certain way with the bag. So even watch how heavy the bags are. When you go to the supermarket, better to use more bags, distribute the items into more bags and distribute the weight between both sides, both arms, because it really does affect your neck too. I know it seems like, well, that would just hurt my arms, but most probably shoulders, and usually when there's shoulder pain, it stems into the neck also. I talked about stress before, and there's so many ways to manage stress, and I'm sure all of you have heard about meditation, breathing techniques. There are meditation and breathing techniques, technique apps or things on YouTube these days, and Instagram. They could help you manage stress. Try to take a little time. Usually, I think it's best in the beginning of the day before you start the day to just take a moment and breathe and have an intention for the day and ask that you have a good day and be thankful for the day that you're about to enter. Being thankful, I think, really helps stress too. And talking to friends about maybe what's going on, even venting a little bit. Sometimes it's just good to talk about stressful situations or things, just to kind of get them out of you, and there's just like so many different things that you can do for stress. I know someone who has a mask that she wears and says, "Positive vibes always." And I think of that anytime I get worried about something, or I'm anxious, or just, stress in general. I think positive vibes, I could get through this. And it makes me smile too. And smiling, it just does wonders. It keeps you young too. We talked about posture and how to improve it. Take that break. Try to sit up with your shoulders a little lower. If you catch yourself, be just more mindful about posture. And as far as dairy goes, dairy and gluten are inflammatory. So they're going to cause pain and swelling and inflammation anywhere in the body. But people tend to feel the pain in the neck also. Okay. Now, with acupuncture and Chinese medicine, one of the first things when they talk about diet and improving your diet and your health is to eliminate dairy. And if you come to Inner Source Health, I've got to say every one of us practitioners talk about eliminating dairy and gluten if you can. I know it's difficult, but dairy comes from a cow, and milk contains a protein called casein. And that's the protein that takes a baby calf and makes them grow into a big cow. Okay, now we're not cows. We don't need to grow that big. We don't need casein, and that can cause a lot of inflammation. as far as eliminating dairy, I tell people, I know it's difficult, try it for a week. It'll probably take that heaviness away from maybe your limbs, your arms, upper back, stiffness. I know I've noticed a difference myself, especially in my legs. I know we're talking about neck pain, but when it comes to eliminating dairy, you're going to feel it in other places too, okay? And usually the first thing you feel is, you feel lighter. I find that, and maybe your digestion will improve too. Okay, this is my favorite part. This is where we get to do some self-care together. You can see Mr. Giraffe here doing a nice stretch. And I just want to start with some shoulder rolls, okay? Shoulder rolls are great because it just works on this whole area and loosens it up. And it just feels good. I don't know, I find I'm more relaxed when I do shoulder rolls. And what you do is you can just follow me along. You can see me, okay? Yeah, just take your shoulders and lift them. First, we'll just lift and drop, okay? Lift and drop. See, I just had to correct my posture. Okay, and lift and then drop again. And then you just do some circles. Backwards. Don't forget to breathe. And then forwards. Great. Okay, good. Kind of loosens everything up a little bit. If you have shoulder problems, please, you don't have to do it. I don't want anybody to hurt themselves. And then we can do a stretch just with the arms first, because everything's connected. The trapezius into the neck. And just lift, just stretch all the way up like that. I'm using my right arm first. And then the left. There we go. And then if you can, if you don't have any severe problems with your neck, you could do a stretch where, I like this one because it stretches both sides of the neck, you alternate. You take your left ear and just drop it to the shoulder. And I can feel a nice stretch on the opposite side. I like to hold this for a little bit. You just let the weight of your head stretch your neck on the opposite side. And then come back to center. And we can do the opposite side. Even felt a little crack there. Okay. Now, some people tell me, well, heat helps my neck. And what I usually say is, have you ever tried moist heat? And a lot of times they say no, they don't have, a hydrocollator, which is like a moist heating pad that a lot of chiropractors and physical therapists use. So I say, well, this is what you could do. This is a simple remedy. You can take a towel, a hand towel, wet it, put it under the water, wet it, wring it out, then roll it up, and you can put it in the microwave for about 30 seconds to 45 seconds. Take it out, wring it out if it's a little hot, and then just, be careful with the heat and put it around your neck like a collar. And it really does just bring a lot of warmth and circulation to your neck and upper back. And a friend of mine who wanted me to come and treat his mother during COVID because she couldn't leave the house, said, please come and treat my mom. She's having terrible neck pain. And I told him, I just, don't feel comfortable going to her home. She is close to 90 years old. With COVID, I just, can't treat her. But I told him to do moist heat collar. She tried it and it worked wonders for her. So I would recommend that to everybody who's having, especially, stiff neck, it's a good thing to do. Acupressure and acupuncture are wonderful for neck pain, okay? Now with the self-care, you can do acupressure on yourself or with, a family member or spouse. And acupuncture and acupressure are very similar. The difference is Acupuncture, you would see a professional, and they would use very fine acupuncture needles to stimulate the points that are acupuncture points, and I'll talk about that in a moment. With acupressure, you would use, or the practitioner would use, pressure with their fingers, okay? So before I get started with any acupressure or showing you a few acupressure points for neck pain, I want to talk about acupuncture, okay? Now, acupuncture and acupressure come from the same system. Back in China about 3,000 years ago, they didn't have the sophisticated machinery that we have today to look at the body. They didn't have microscopes, but they sensed that there was energy flowing through the body, and that energy they referred to as qi. It's a loose translation, but energy pretty much is qi. And they sensed that the qi flowed through channels or meridians that ran through our arms, through our legs, through our torso, through our head, that contained the qi, and along these channels were points, and those points are where the qi really gathers and has certain functions for healing the body. Okay, I had talked about stagnation in the body. When we do acupuncture or acupressure, we're really looking to have the qi of the body flow smoother so there's no pain, okay? Then there's other things that acupuncture does for the body as far as, you know, digestion and other organs. But when it comes to pain, we really, one of the key things is to have the smooth flow of qi. And we use specific areas of the body. And if you look at this diagram, you can see the channels are the lines. The points along the channels are the acupuncture points or the acupressure points, okay? So if you're seeing an acupuncturist, they probably use many of the points you see here or on the arms or the legs to do the treatment, you know, with needles, with acupuncture, or you know, we could use acupressure too. Now with acupressure, like I said, you use your fingers. I like to use my thumbs on certain points because I have more strength with my thumbs. And basically, you find the point. I'm just going to, I don't know if you can see my arm, and you can just, you know, press in and do some circles, okay? Just like you're massaging in little circles, and that really stimulates the point there. And it's called circular digital pressure. Or you can just press into the point, and I usually say do this for about a minute, okay? And it just goes back to, you know, mom, when you hurt yourself, your mom pretty much, you know, just said, okay, let me press here, let me rub here and make it better, okay? Same idea with, you know, acupressure, although it's a little bit more advanced. We're doing it on specific sites with specific functions. I hope that's clear, okay? Because there's a lot more to it, but I'm trying to keep this simple so that we could do a couple exercises, you know, on our own, you know, together and on your own if you care to. So with the acupressure for neck pain, one of the best points is gallbladder 20. Now, GB is gallbladder, 20 is the 20th point on the gallbladder channel. I don't know if I said this, but many of the channels are associated with organs on the body because they run through the organ and they carry the energy of that organ. So this point here, GB20 is gallbladder 20, and it's at the base of the skull. And to find this point, you basically could take your hands, take your thumbs, put them on your earlobes, and just slide across the base of your skull, back ahead. And there might be a little divot there where the muscles come in. Like sometimes there's a little hole there. If it's not the exact point, that's okay, but you could just do little circles with your thumb there, and it'll just release a lot of the tension. I could do this for about a minute as I'm doing it. I'm just doing little circles or just press in. And this is a great point because so many of the muscles of the neck, like I said, attach to the back of the head. Okay, and you can even come across, you know, closer to the middle, you know, the midline of the body, the midline of the back of the head. You just across the whole base of the skull and do some acupressure and even a little self massage. You could use, you know, your fingers, your fingertips, and just do some circles along the base of your skull on each side, on the back of the head, And it really relieves a lot of tension in the neck that causes pain. Okay. There's another point I want to show you. This is on the gallbladder channel also. It's the next point, 21. And it's at the high point of the shoulder. I talked a lot about the trapezius muscle, which, leads up to it runs up to the back of the head here. It's the muscle that, gets tight when we, hold our shoulders up. And this point is very good for releasing tension in the trapezius, which is associated with neck pain. And it's right at the high point. It's kind of hard to do on yourself. It's better maybe if somebody else, pressed in, maybe one of your kids or significant other. And usually there's a knot here too. There's always that spot you can feel. And you can just press in and do the circular digital pressure. I'm not using my thumb here. I'm using my index finger and middle finger. And I'm just doing some pressure here. Okay, for about a minute. And the other side. Usually you can find that spot. And like I said, maybe there's a knot there, trigger point. Might even be a little tender. Good.
Hi, Vicki. This is Peter again. I just wanted to let you know we can't see your video from here.
Oh, I am so sorry. Okay. Well, you know what? I'm almost done here. I really wish that this was a better presentation, everyone. I hope, I didn't disappoint you, but, yeah, I really wish I was able to demonstrate this better, but I hope you're getting some good information from this through the pictures and just by the description that I'm, the verbal description that I'm doing. One last thing before we go, we're towards the end. I wanted to talk about pillows because pillows really can, contribute to neck pain, or they can help it, or, help prevent it, I should say. And many times people say, well, what kind of pillow do you use? And I don't use anything in particular, to be honest, but I would suggest using a pillow that's not too high and not too flat. You kind of have to, experiment a little bit, but height is very important. I wouldn't recommend sleeping on a stack of pillows unless, of course, you have other conditions such as acid reflux, but I would say, a pillow with good support and a medium height is best. You don't want a pillow that's too big because your head will be, flexed at a severe angle, which, could cause other problems. And it really is, pillows are like mattresses. You kind of have to find what suits you best. But I did want to make a recommendation. If you have a pillow and you want better support for your neck through it, what you can do is you can take a small bath towel, and I'm sorry, you can't see my video here, but you can roll it up. So you take a small bath towel, roll it up tight, and you could slide it into your pillowcase at the front, and you can use that to support your neck and head. And that'll give you a little bit more support when sleeping, okay? And that's good for either sleeping on your back or on your side. Okay, here's some references. And I want to thank everybody and apologize, sorry about, the technical difficulties. But if you have any questions, please feel free to email me. My email is here, victoria@innersourcehealth.com. And the phone number at the office is 631-421-1848. I'm available for acupuncture and massage. If anybody's interested or has any questions, please contact me, and you can visit me at Facebook and on Instagram also. Okay, I don't know, with my difficulty today, I don't know if I can see any questions. Dr. Bongiorno, are you there?
Oh. Yeah, I'm here.
Okay.
Yep.
I'm going to
Yeah,
Do you see any questions? Anybody have any questions today?
I'm just taking a look. Yeah, I have one question.
Okay.
Let's see, and it's what when somebody has a pain that's been going on for a long time, is it better to do hot or is it better to do cold?
That's a very good question. And different people will give you different answers. I prefer heat. As I mentioned, moist heat I find to be very effective because it brings blood flow to the area, which will help heal and relax the area, while ice constricts. The only time I would really recommend ice is like an acute injury, for example, like a sprain an ankle, to get the swelling down. But for long-term pain, I like a heating pad, heat, or moist heat.
Okay. And another question here is, when you first get injured, how do you know, and your neck hurts, how do you know when you really should get to the doctor versus, try to treat it yourself?
Okay, another good question. First, I would say if you're in a car accident and it's more than like a slight fender bender, I would suggest getting it checked out right away, okay, in case there's more of an injury than you may be presenting with. As far as you pretty much have to go with your own instincts. I would say better to get things checked than not to. To get an MRI, see a doctor. Especially if you've been any kind of traumatic injury, sports injury, like I said, motor vehicle accident, a fall, elderly with falls, I would say always a good idea to get things checked out, by a doctor.
Okay. And someone else saying, thank you so much for this and all the other webinars you've done. They're really great. I've been sharing them with friends. And the one question that they had is, for someone new to acupuncture, what can she tell them in terms of if they're going to go for acupuncture to help pain, how long do you expect to start to see results? Is it something quick or is it something that takes a while before you start to see benefit?
You can see results right away. I would say the longer you've had the pain, the longer it can take, though. That's the one rule of thumb, if I can have a rule of thumb with this. I usually recommend several treatments in the beginning, 5 or 6 treatments. You might, see results after 1 or 2, but I always recommend, 6 treatments, 5 or 6 treatments, and then, evaluate, see where you're at, and then maybe scale back on how often you're treated. But depending on the severity of the neck pain and the cause, it varies. But people do get results quickly. They can.
Awesome. All right, and I have one question, Vicky.
Sure.
If you don't know a patient and they're in pain, and you wanted to give them one acupressure point to do, which one would you tell them to do, and how would you tell them to do it?
Okay. If they're in pain with neck pain?
Yeah, neck pain. Neck pain. Mm-hmm.
Okay, with neck pain, I would go with the one that I had showed first here at the base of the skull. Because even if you're a little bit off as not being an acupuncturist or trained in acupressure, you will get some kind of relief just by doing circular digital pressure, the acupressure, or even a little self-massage on the base of the skull. I think it could be very effective. That's usually a starting point whenever I do acupuncture for the neck or even massage. They call it the occipital release, and it really releases many of the muscles of the neck. So I would go with this point here.
All right.
Gallbladder
Terrific.
20.
Gallbladder.
Okay. Yeah.
All right. That's it.
Okay. All right. Anything else? Everybody okay?
That's all we got here.
Okay. All right. Well, thank you again. I hope that you learned and you got something to take home and share with others. And I appreciate your patience through this webinar, but I hope you enjoyed it. I enjoyed myself too. So have a good rest of the evening.
All right. Good night, everybody. Thank you, Dr. Vicki.
Bye.
Bye-bye.